Hello, everybody. I'm Michael Messenger, President of World Vision Canada, and I'm delighted to welcome today Dr. Greg Allgood. Greg is the Vice President for Water at World Vision United States. He's also an adjunct professor at the University of North Carolina Water Institute. Is really one of our global leaders in helping to address the clean drinking water crisis around the world. And Greg, it's really great to have you with us.
Thank you, Michael. Great to be with you.
We've got a few questions for you as we understand what water and sanitation and hygiene, sometimes we say WASH, means in the world. But we are dealing with the COVID-19 pandemic. What impact is this pandemic having on World Vision's work around the world, and why is water and sanitation so critical right now?
Well, clearly, COVID-19 has impacted everyone everywhere, and that's no different in the places where we do our work helping the most vulnerable. When you think about COVID-19 and the developing world, you can look at it from a couple of different angles. Some things are positive. When you look at sub-Saharan Africa, they quickly took steps to lock down, social distance, and so far, that's limited the spread of the virus. And in sub-Saharan Africa, the population is about half of what we have in North America. The average age is only 20. And we know that the virus is less severe in younger people. However, we know that it's more severe in people who are vulnerable. There's a lot of people who are malnourished, have malaria, have HIV/AIDS. And so the virus could be more severe because those people have a reduced immune response. Also, we know the virus attacks the lungs, and there's a high rate of people that have pneumonia and tuberculosis. So the thing that we need to do is prevent the spread of the virus, and we know that we need to wash our hands and use physical distance. And so that's the work that World Vision is focusing on. In the developing world, in areas where we work, reaching the most vulnerable, only half of healthcare facilities have water on premises, and only 16%, 16% have basic hand washing facilities with soap and water. So just imagine doctors and nurses not being able to wash their hands between seeing COVID-19 patients. So that's an area where we're focusing.
So you're talking about clean water for washing hands in medical facilities, but World Vision's work in water, sanitation, and hygiene is broader than that. Tell us a bit about what World Vision is doing to help bring clean water, and what are you focusing on right now?
So World Vision's work to provide clean water, hygiene education, or hand washing, and sanitation has us be the global leader now. We've reached one new person with clean water every 10 seconds. That's an unprecedented rate. A lot of people have heard that, but what they haven't heard is that we also reach one new person with hand washing education every 10 seconds. We're the global leader in hand washing education, and this is one of the most critical things that you can do to prevent the spread of the virus. So what World Vision is doing pretty much in all the countries we're working in to respond to COVID-19, we've educated our staff. We've told them how to protect themselves, how to prevent the spread of the virus in their own households. Then we're going out to the communities in which we serve. And we're having to do this in a number of different ways because of COVID-19. So we may be using bullhorns, or in some places using radio to educate people on what they need to do. And we are working in those healthcare facilities, helping frontline healthcare workers have personal protective equipment. We're providing tons of disinfectant and bar soap so that they can protect themselves. We are a global leader in providing water, sanitation, and hygiene in healthcare facilities. Last year alone, we reached about 400 of them, serving about 3.5 million people. So this is the type of work that we're scaling up now to deal with COVID-19.
And all the more reason that we need funding and support to expand our work in bringing clean water and sanitation and hygiene education to vulnerable communities. I recently traveled to the Democratic Republic of the Congo, one of the world's most fragile places. In fact, some of the most vulnerable girls and boys in the world live in DRC. And this year, Team World Vision is going to be raising funds for the DRC. Why is providing clean water, sanitation, and hygiene so critical for children in fragile places like this country?
Yeah, the DRC is one of those places we work that's so vulnerable. A lot of lack of infrastructure because of the long civil war and conflict there. We have a strong team there. I'm glad that that Team World Vision Canada is supporting DRC. Last year, we reached more than 100,000 people getting clean water for the very first time. And we've reached more than 100,000 people with hand washing education. In DRC, there have been outbreaks of cholera and even Ebola. And so World Vision is really an expert at dealing with the outbreak of infectious diseases. You know, it looks sort of scary and very foreign to us to see things like isolation tents appearing in Central Park in New York City, but that's not foreign to World Vision staff. We have those isolation tents and the protective equipment, and we know how to respond, including in DRC, because of the cholera outbreaks and because of Ebola outbreaks. In fact, we're experts at this, and we've been recognized for such in the medical journal Lancet because of our work with faith leaders and community health workers to prevent the spread of these infectious diseases. So this is something that is going to, when people support Team World Vision, they're going to be helping directly prevent the spread of COVID-19 in the developing world. And that support may save a life.
So when Team World Vision raises funds, getting funds to the DRC for water and hygiene, we are saving lives in one of the world's toughest places.
That's right. That's right. Every $50 not only provides clean water that lasts for a person, but it also provides that hygiene education, that hand washing education, as well as sanitation.
That's so encouraging. Greg, thank you so much for sharing the story of World Vision's work on the ground. We can all be part of this amazing impact through Team World Vision Canada this year. Thank you very much.
Thank you, Michael.
Hey, God bless you. Thanks.
God bless.